Well, look, as far as why I wrote the book, for some reason in healthcare, we as healthcare leaders, we as clinicians have always accepted mis and disinformation as that wallpaper in the background, right? Just something that existed in the four walls of the hospital, but no one really paid attention to or acknowledged. And really that became very highlighted during the pandemic, right? When we look at the stakes in terms of mortality, morbidity. And for me, it was really a flashback to when I was a young doctor during the HIV/AIDS epidemic. And I remember sitting in lockdown in my home office saying, how could we have let this happen again? Because during HIV/AIDS, and the first chapter of the book actually starts out with my patient Jerome, who dies of AIDS, and insists that he's not homosexual, and he could, therefore I was wrong, and he couldn't possibly have AIDS, right? And so it just, to me, was a repeat of history when we were told at the time of the HIV/AIDS epidemic, this was once in a lifetime. It wasn't going to happen again. I was a young doctor again. It was meant to be like a hopeful message.
Yeah.
And then here I was during COVID working with my medical students and residents, finding myself saying the same thing, right? And so I wrote the book, namely because I felt that the wallpaper, right, this wallpaper we've accepted as part of the ecosystem, needed to be called out because it was a repeat, but also because it's getting worse. Because of technology, namely artificial intelligence, social media, mis and disinformation actually travel 6 times faster than the facts. That is a new phenomenon, Laurie, right? Mis and disinformation have been around since the Black Plague. Some neighbor
Right.
told you this, somebody told you that. But now it's very different.
This is Inspiring Women, and today I am finally speaking with the Dr. Geeta Nayyar. She is a nationally recognized healthcare technology leader. She has been the chief medical officer of enormous tech companies like Salesforce, like AT&T, but she is very well recognized for her nationally acclaimed book, Dead Wrong: Diagnosing and Treating Healthcare's Misinformation Illness. She's an expert in AI. She is an influencer, and she is here to speak with us today. Geeta, I have been wanting to talk to you. I think it's 2 years. I've been trying to get you on the program, and finally, I have the chance to talk to you. Thank you for doing this.
You bet. Likewise. Yeah. And I think that was like pre-COVID when both of us had white walls. Now you've got a red wall, I've got a blue wall. So thanks for finally having me on.
All right. Well, this is great. So, listen, I think the whole world knows you, and you have been doing a service for all of us, seriously, because the book that you took the time to write, which you were doing when you were, the big job that you had at Salesforce. Today, you are an advisor to so many organizations. But you wrote this very, very important book, Dead Wrong. I want to actually go a little bit backwards, and maybe, Geeta, just like you got into medicine, that alone is a big enough job. Then you turned to technology and were a leader there. So maybe just, if you wouldn't mind, a couple minutes on the Wayback Machine and sort of like, how did you get here?
Oh gosh, that's always a fun question. Look, like everything, I was either in the wrong place at the wrong time or the right place in the right time. It just depends who you ask. I'll tell you that my journey was really interesting in that I became a rheumatologist because my mom actually has a very rare autoimmune disease. And like every South Indian family, we would go to the doctors as a whole family. I've got 2 brothers, dad. And my whole life, my mom was told she had an autoimmune disease that we weren't quite sure what it was. And so I became a rheumatologist mainly for that reason. I was intrigued. I thought, maybe somewhere along the line I could help my mom. And my mom was actually dying when I became a rheumatologist. I was my rheumatology fellow. I was a rheumatology fellow at the time. And a big part, and the long and short of it is my mom is thriving, living her best life. She's 76. She lived to meet my daughter. But she was misdiagnosed her whole life until I diagnosed her when I was a rheumatology fellow, actually. And a big part of her journey was that her data was in disparate places, right? So she had an esoteric diagnosis, no doubt. Access was certainly an issue to a rheumatologist, which it is across the country, across the globe. But so much of her journey was that cardiology didn't know what neuro was doing, neuro didn't know what endocrine was doing, et cetera, et cetera. And so a big part of the role I played was not just my knowledge of rheumatology, but actually connecting the data points.
Yep.
And this was when the EHR was just starting. So many
Researcher, caregiver, and putting it all together is a difficult job, right? Even if you know what you're doing in healthcare, but it's complex even then.
That's exactly right. And I'm a physician. My dad is a physician. My mom is a physician. I mean, you couldn't ask for more blessings in terms of resources and knowledge. And it was still quite a journey for us. So a big part of why I dedicated my career to health tech is related to my mom, but also to my patients, because I said, how many people can have a daughter who is in the specialty of their diagnosis and disease, and then also shepherd their way through this information? Because being a physician is very much like being a detective, right? And if you're missing clues, I mean,
Yeah.
you're going to be further off from, finding the murderer, finding the diagnosis. And so much of my mother's journey was really that being the person that would get all the information together, connect the dots, and then was able to make this esoteric diagnosis. So it's really how I ended up in health tech. It was very much with a focus on how to empower patients to be their own advocate, to navigate the system. And we certainly have a lot of work to do still, Laurie, but I think we've certainly made progress. And so my role at AT&T, Salesforce, a variety of companies I still work with now, is doing that. Is trying to move the industry forward to make the consumer that much more savvy.
Yep. And I agree. We have made a lot of progress. I did a recent conversation with experts in the interoperability space. And if we just talk, I mean, we have so much data at our fingertips, which is wonderful. And maybe the electronic clinical data highway has been paved. But, since you've worked so deeply in health tech, you also have become really an expert in the area of AI. So I just, before we even get to dead wrong, I'd love for you to just maybe give a bit of perspective of when that technology, and AI is not new, but it's newly, into, the public's awareness of how very, very powerful it is. And just like you saw it coming before it became, sort of everyone's daily conversation.
Sure. So look, I think there couldn't be a more exciting time to be a healthcare leader, right? We're living in the era of artificial intelligence becoming a reality, whether we're talking about generative AI, large language models. I mean, there's no dearth of innovation in the post-pandemic era that you and I are living in, right? We get to be at the table shaping the next transformation of healthcare. So I think it's incredibly thrilling. Where I think it's incredibly exciting on the clinical side is when we think about personalized medicine and actually being able to, excuse me, better do diagnostics and therapeutics, very similar to what we saw during COVID, right? mRNA vaccine overnight in what would have previously taken many, many years. So I think that space is particularly exciting. What I think we have to be careful of is when we talk about living in a physician shortage, an era of physician burnout, this idea, mostly it comes from the technologists, right? That say, well, don't worry about it. We'll just replace those doctors and nurses with generative AI, right? And that's exactly the right answer, because that's the wrong problem to solve. So I'm always very cautious of what I think is limitless potential with generative AI, et cetera, but making sure that we are really focusing on the right problems. Because the technology can do so many things, but what we need to be really mindful of is that we are not distancing the patient-physician relationship, which we have done in the past with many technologies to date. And so one of the things we have to be mindful of is looking at lessons learned from the electronic health record era, things we've learned from social media, any number of innovations we now have data on, right? We have research on. And what we learned from the EHR is we solved 3 problems and then we created 5 new ones.
Yeah.
Right. We launched scribe services. I mean, we launched an entire new business around documentation and put 3 people in the examining room to ask our patients about sexual history, family history, alcohol and drug use. I mean, you name it, right? We changed the fundamental dynamic between doctors and patients, and we burnt out our staff, right? We burnt out our staff. And so we can't afford to do that with AI. AI is even more powerful.
Yeah.
And so I think it's really about directing it at the problems of today that it can be more impactful on. And some of them are not very sexy, Laurie, right? I'm talking clinical decision support, prior authorization, documentation, accurate documentation, right? So these are the things to focus on. Diagnostics and therapeutics is a huge one. Again, I think that's probably one of the most exciting ones if we think about leapfrogging actual diagnosis and clinical care, but replacing that doctor at the bedside, replacing the nurse at the bedside, absolutely wrong problem to solve. We're going to make things worse. But if I think about navigating the healthcare system, information, I mean, there's so much low hanging fruit because we have such a dysfunctional healthcare system. So we
Yep.
just have to be mindful that our bad habits and our good habits will only be amplified by this technology. So we want to point and shoot in the right places.
Yeah, well, I also think, like it might be the non-sexy kind of problems that are advanced first, but like let's have at it because that level of burden that you're talking about, I mean, that's only gone up over the years. And I know you're an advisor to the American Medical Association. Certainly when I was there, the physician burnout, clinician burnout, it was real, but only getting worse. Then we had a pandemic. I'd like to shift maybe a bit to the premise of your book, Dead Wrong, because certainly, one of the things, and this was so interesting to me, I know a lot about electronic health records. I know about the systems that sort of like, were the early technologies there, but this whole world of social media and other types of information that have become so important for human beings to learn about their health, maybe not, and social media and all of that has contributed to a different level of problem, almost an exponential problem, which I think is a bit of the backdrop of Dead Wrong. So maybe just bring us back to some of the key premises of Dead Wrong and why you felt so compelled to write it, because it's been very impactful.
Thank you, Lori. Thank you so much for that. Well, look, as far as why I wrote the book, for some reason in healthcare, we as healthcare leaders, we as clinicians have always accepted mis and disinformation as that wallpaper in the background, right? Just something that existed in the four walls of the hospital, but no one really paid attention to or acknowledged. And really that became very highlighted during the pandemic, right? When we look at the stakes in terms of mortality, morbidity. And for me, it was really a flashback to when I was a young doctor during the HIV/AIDS epidemic. And I remember sitting in lockdown in my home office saying, how could we have let this happen again? Because during HIV/AIDS, and the first chapter of the book actually starts out with my patient Jerome, who dies of AIDS, and insists that he's not homosexual, and he could, therefore I was wrong, and he couldn't possibly have AIDS, right? And so it just to me was a repeat of history when we were told at the time of the HIV/AIDS epidemic, this was once in a lifetime. It wasn't going to happen again. I was a young doctor again. It was meant to be like a hopeful message.
Yeah.
And then here I was during COVID working with my medical students and residents, finding myself saying the same thing, right? And so I wrote the book, namely because I felt that the wallpaper, right, this wallpaper we've accepted as part of the ecosystem, needed to be called out because it was a repeat, but also because it's getting worse because of technology, namely artificial intelligence, social media. Mis and disinformation actually travel 6 times faster than the facts. That is a new phenomenon, Lori, right? Mis and disinformation have been around since the Black Plague. Some neighbor
Right.
told you this, somebody told you that. But now it's very different. And now we have misfits out there really victimizing our patients who are only looking for information about their health because they want to be healthy, by the
Yep.
way. So to be clear, nobody's waking up in the morning saying, how can I be the fool today, right? You have consumers today that are looking to social media in the absence of having a doctor or being able to get an appointment saying, okay, well, this TikTok influencer seems to know what they're talking about. And they say, if I take this supplement for $9.99, I won't get breast cancer. So the myth for the mammogram happens, right? The myth for even having a primary care doctor happens. And so it's really imperative for us as healthcare leaders to understand that this is now new competition. This is a new kind of patient loyalty that's being built. And for anyone doing fee for service or value-based care, this is now who you're competing with, right? And so how do we as healthcare leaders actually embrace these technologies, take the narrative back, and say, you know what, the wallpaper should be really red like Lori's because it's a better
Yeah.
wallpaper, right?
Well, but it's such an important thing. So, like, let's take, for example, vaccine hesitancy. Like, when did this become such a big deal? When is it, what world are we living in that measles is suddenly like, actually happening again in ways that are alarming? And so, to me, those are representative of this powerful disinformation that you're talking about. And as physicians, as clinicians, as leaders, how do you take back the narrative?
Well, again, and I cover this in depth in chapter 8 in the book, but there's a really great use case of the Cleveland Clinic, where actually it was the chief marketing officer that walks over to the chief medical officer's office, the CIO's office, the CFO's office, and says, hey, we got a problem. Our community doesn't trust us. And we have some of the world experts, we have some of the world's innovations, but somehow that message is being missed. And you guys are the doctors, you're the money man. This affects our money, our patient revenue, our acquisition, retention. And I love it because it's such a good example of a C-suite strategy, and one that isn't asking our doctors to now do 6 more things, right? The chief marketing officer essentially put together the messaging in conjunction with the clinical team who knows science and does this every day, right? Made sure they comb their hair, they look nice on camera for 30 seconds, and then actually reached out to YouTube and partnered with social media companies like a YouTube and said, look, we're available to everyone, anyone, and we're also accountable, right? If we say something, we'll have an appointment with you virtually or otherwise. So we're accountable. Very different from the social media space, right? Where you can say something and you have no license potentially, or you just deactivate your account, and it's very much a good luck relationship, right? And so there are ways to do this at the enterprise level, but I think, Laurie, fundamentally the shift in mindset is that in healthcare for so long, particularly in academia, we've always thought of marketing as a nice to have, not a must have. And the reality is marketing is now patient education, right? Marketing is now patient education. And 59 million Americans turn to social media for decisions about their health. So if we're really a healthcare enterprise or system, we say it all the time, we want to meet the consumer where they're at. Well, that's where they're at, right? So why would you not claim the real estate there? Why would you not, shout from the mountaintops the knowledge that you have, but also the I will take care of you piece that no one else on those platforms can say except for the healthcare enterprises, right?
For the average physician, the average clinician, do you think it is almost a fundamental requirement that they need to be social media savvy? Or like what are your expectations of what it's going to take to sort of continue to command that level of trust and also influence for the people that they serve?
So again, I start with, we can't ask our doctors to do more than they do, right? And fundamentally, you want your doctor to be the best doctor they can be. I'm not interested in seeing a social media expert, right? I'm interested in seeing a medical expert. So I think that for those physicians who happen to be inclined, and there are many influencers out there, Dr. Mike, Dr. Austin Chang, I think it's wonderful. But what really scales is at the enterprise level. And it's exactly the Cleveland Clinic case. I think it has to be the marketing function working with the clinical function, and it can't be a side hustle. Right. To your point, this has to be something the enterprise invests in, sees as valuable. We can't ask our doctors to now go home and do their notes and then put up a TikTok video. It's simply not, I think, fair, nor should it be a burden. But I do think every enterprise has a chief marketing officer, and this is something they need to work in tandem with their chief medical officer with, and the CFO to be able to show the metrics, because again, we too often look at these things as nice to haves, as cost centers. And if you're really interested in value-based care, if you're interested in patient acquisition, patient loyalty, preventing bounce backs, look, if you're getting that 1099 supplement, Laurie, you're not getting that mammogram, right? You're not getting the colonoscopy. Heck, you're not even making a visit to the doctor because you don't feel like you have to, right? And you don't have the same access. So I would say, again, just like the business of the day in healthcare, this has to be a C-suite priority. But it's interesting because when I speak around the country, speak around the world, frankly, because this is such a common phenomenon, I always ask who's in charge of consumer experience, patient acquisition, loyalty, value-based care, and like a million hands go up. But when I ask who's in charge of the mis and disinformation strategy, no one ever raises their hand. And everyone claims to be doing this. And so it's just such a great indicator of that wallpaper. We miss it every time and we just accept it as part of the narrative. And the difference is, in the provider space in particular, we're always competing with the other provider down the street. I don't think that's the case anymore. You're now competing with the influencer down the street who has an entire business online for the most part.
Who's not down the street, who just happens to be sort of like in your algorithmic TikTok reel. that's out
Correct.
there. Geeta, I wanted to, even though your expertise, of course, is the healthcare landscape, we are in an election frenzy time right now. And if we talk about disinformation, it is quite obvious, sort of like how that can influence these mega shifts politically. And if we look at this current election, it's my observation that healthcare is not really on the ballot box, in the way that it has been historically. What are your thoughts about that? And what should we be thinking about from more of the political landscape and what you are expert in, AI, healthcare, and all the policy that goes with that?
Well, I really appreciate that question because I think we have a shared sentiment there, right? And certainly when Biden and Trump were both running against each other, my thought was the same, which is, both of these presidents were the president during the pandemic, and no one's talking about public health infrastructure. No one is talking about how are we going to regulate or think about social media and mis and disinformation as it relates to our health. Again, not a pandemic issue, but we saw it play out globally all at the same time. And so it is really disappointing to see that that is not part of the dialogue, because clearly we have gaps in our public health infrastructure. And I will tell you, one of the big lessons I also learned as a CMO of Salesforce is public health in the United States, at least, is largely employer health,
Mhm.
right? And so what are we doing to also help our employers be smarter, better, faster about instilling good information, good decisions? And every employer struggles with this. How do you even get your employee to understand, go to the urgent care before the ER, right? And obviously have a doctor if you can, but there are small things about public health education that continue to be amiss. Women's health is obviously part of the conversation we're seeing now, but there's so much more to
Right.
healthcare. And I would love to see that. I hope that we hear that before November, but I share your sentiment that it is disappointing. And I don't know if that's because everyone wants to forget COVID, but I know all of us as healthcare leaders are really hungry and thirsty to never go through that again. And so we are
Right.
looking for a leader that ensures our system is ready and aware and able.
So much of the work that you do, I mean, you're giving us both sort of like you're giving us the diagnosis of what disinformation looks like and how impactful. You're also giving us practical solutions for how esteemed organizations and even just like any organization can begin to combat those things. I'm just wondering, from your lens, do you have bright spots that you think about? Because it's hard to not be overwhelmed. 6 times more likely to hear the, not true things and have those. I mean, those are big numbers. Are there any bright spots or things that we can be optimistic about?
Absolutely. So again, first of all, we are living in the most exciting time, I think, in history in healthcare. I mean, we have made it through a pandemic. We have made telemedicine is now part of medicine. It's not really special. Hybrid care is here to stay. I think we'll continue to get more sophisticated in that regard. Reimbursement for those services is here to stay. And look, we have a consumer generation and a medical generation, right? The medical students and the doctors in training I work with, they're very tech savvy. They're very tech forward. They are only going to push the innovations, particularly artificial intelligence, to a whole new level. And we're going to be ready for it because that's no longer going to be the new kid on the block. So I think there's endless hope. But why not start now, right? I always kind of call to action that if we don't do it now, when we have every innovation that 50 years ago we couldn't have even imagined, and we have a climate that is primed for figuring this out, it's really a now or never moment. And I think it's also a moment where we need to start accepting a little bit of failure, right, Laurie? Because the truth is, we are still learning. I would not pretend to actually to say that there's the guru out there as it relates to AI, because we are still learning, and we're certainly still learning its application in healthcare and
Mhm.
what will be the right moves to make versus ones that will cause increasing health equity. We have to be mindful of ethical uses, but I think this is the time to try everything, right? And innovate and fail fast, because the faster you fail, the quicker you get to success. That's always been sort of my motto. And even as a mom, it's always been my motto: go out there, make some mistakes, right? Because you're going to get up and you're going to make new mistakes, but hopefully not the same ones you just made. And so I think we do have that appetite in healthcare when we are playing with some of these more innovative things.
Well, I love to hear that level of optimism and energy that goes alongside it. Geeta, I can't not talk to you and not talk about women in leadership. And yes, it's been a long road, and there are so many more women who are in leadership positions and positions like yours of immense influence and impact. And I just love to get your perspective, all the hard lessons learned of how you got there. Those are not how you present yourself. And there's no just like, oh yeah, it was hard. You are all about hard charging and really laying out a future vision for what is possible. So just I'd love your thoughts on sort of like, where are we as women leaders today? And what do you think about in terms of the lasting impact or the acceleration for more women into leadership?
Well, first of all, Lori, again, thank you for having me. Thank you for making me feel good. I feel like they got my morning dose of
You're the
some love.
best. You're the greatest.
What are you doing tomorrow, Lori?
I'm fangirling you.
Thank you for that. Thank you for this podcast, because I love that this is, the theme of the podcast, and that you're having any number of folks that I also admire on. I would say that I tell my daughter this all the time, it takes a lot of energy to make it look easy, right? And once people are successful, everybody wants to be your friend. But whom I always remember is the people who helped me get from A to B to C to D. And the question I then always ask myself is, how do I pay that forward? Mm-hmm. Right. And for me, I think one of the places that I've just personally invested and gives me the most rewarding is the younger generation. And whether that's my 12-year-old daughter to the medical students I work with, I very intentionally included both my daughter and one of the medical students that I mentor at the University of Miami in the book. I don't know if you looked at it, but they're both now best-selling illustrators in the book. And I came up with that idea 1 week before it was due to the publisher, by the way. And I sat down with both of them and I said, listen, I've been thinking about how to incorporate you guys in this book. And this is the only thing I can come up with, because it's a very sophisticated healthcare book. And I literally ordered every day. I got pizza, Thai food, whatever they wanted. And they sat down in the living room, and I had to explain every chapter to them, by the way, because there was no time. And it's not like my 12-year-old, she was 9 at the time. But the point I'm trying to make is it was an intentional inclusion, and it remains intentional to include them in everything I can related to their work and their merit. But I think we also have to not just support each other, but also look at the girls in their 20s and 30s. If I think back on the places where I could have had the biggest delta or the biggest support, or saved myself some grief and some time, made more financial wealth as well, I wish I had that big sister. I wish I had that, second mom, grandmother, even, right, to say, hey, Geeta, you're at this place now where you need to do X and you need to do Y. And I think I got there with a lot of luck and accidents and also mistakes. But I would love to see us in this next generation. It shouldn't be so special to have women leaders. We should just have great leaders across the board. And I'm a big believer that talent is everywhere, but opportunity is not. And I think what excites me the most about seeing leaders like yourself, seeing so many of my colleagues now in positions, is we can create opportunities, whether it's internships, whether it's being thoughtful about some major project we know will be successful, or an organization. How do we bring more young women along? Because that's, I think, fundamentally the way to change things, right? And while I see the other place I see this is I see more women in leadership positions, more C-suite positions, but I still think there is a barrier at the CEO level and the board level. Yeah. And so I think that we have to be intentional kind of about both extremes, the uber high level and then the youngest levels.
Geeta, that is profound. And just to sort of like double click on your points, I mean, those years, the 20s to 30s, okay, if you can take 10 years of hard work for a woman who is aspiring to leadership and condense it to 5 to 8, okay, you are accelerating, the gender equity gap, tenfold, like just easily. And those critical moments at the earlier stages of the career are absolutely powerful. And powerful women like you going in, plucking and helping, showing the way, clearing some ground, critical. And then similarly at the, other end, the C-suite, where you can sort of get jammed, and just like that's where the next level, the next leap, but there is fewer of them to make the leap. Like there's more pushing and pulling needed there too. Everything in between, we're actually kind of doing okay, I would just say broadly, but those are two really impactful spots. I'm so glad you highlighted that.
And I also I have one more point, Laurie, also, so many people that have helped me in my career have been men,
Yep.
actually, because I think for our generation, right, there weren't as many female leaders, but I've had extraordinary male mentors. And I think we find mentorship in many places. And we have many men who either just think like that or have daughters and sisters and wives and are more than willing. So I think we also need to be mindful that anyone that wants to help, right, is certainly welcome. And it needs to be very much I'm a big, maybe because I'm, South Asian, I'm a big believer in karma, but so many people help me, and I'm very thoughtful about paying it forward. And so I think we have to create that culture that when you're given an opportunity, then when you get it, how do you look back and also bring some folks with you? And we can't all bring everyone, right? But if everyone brings 1, 2, 3 people, it's a culture shift, right?
It's an enormous shift. Well, I think we'll close out on that, Geeta. This has been just an amazing, inspiring women conversation. And I've been speaking with Dr. Geeta Nayyar. And Geeta, you are an inspiration to many. And I just also personally want to thank you for the enormous impact you're having on so many important problems of the time. Thank you so very much.
Thank you, Laurie. Thanks for having me.
This has been an episode of Inspiring Women with Laurie McGraw. Please subscribe, rate, and review. We are produced at Executive Podcast Solutions. More episodes can be found on inspiringwomen.show. I am Laurie McGraw, and thank you for listening.